Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. Our guest today is Janet Hieshetter, Executive Director of the Dystonia Medical Research Foundation. She's with us today to discuss the results of a survey that her foundation was involved in along with Allergan Incorporated. The survey shows a greater need for awareness of cervical dystonia. Welcome to Health Professional Radio, Janet.
Thank you. I appreciate the attention that you're devoting to dystonia this morning.
Well, thank you for joining us. Most of our listeners, as a matter of fact, are healthcare professionals themselves. I personally have not heard of dystonia. What exactly is dystonia?
Dystonia is a neurological movement disorder that results in abnormal muscle movements and fixed postures and positions of the body. Essentially, it's the body sort of taking over control of voluntary muscles, affecting either the entire body, or dystonia can focus on one particular area, like in the eyes or the neck. We provide information and support and actually do research into all forms of dystonia, supporting the patient community for people who are affected by every form of dystonia. Okay. Cervical dystonia happens to be the most prevalent form of dystonia, so definitely involved from that perspective.
Okay, so there are many different types of dystonia. Is dystonia something that affects men and women equally, or is it confined to one sex or age group?
Unfortunately, it affects men, women, and children. There is a slight increase in the number of women who are affected by cervical dystonia, but it doesn't discriminate. Everyone's potentially affected by dystonia.
What are some of the symptoms of cervical dystonia?
So cervical dystonia, as I mentioned, is one of the more prevalent forms, and it affects the muscles in the neck. So even though dystonia is a neurological disorder, it sort of presents from a muscular standpoint. And in cervical dystonia, the head can be tilted and moved. The muscles can pull the head to either side, or it can pull it down to the front, sort of where the chin might be resting on the chest, or in rare occasions back, where the head is actually pulled back. And to try to sort of imagine what cervical dystonia is, I sometimes encourage people to think about balancing a tennis ball between their ear and their shoulder. So your head is being pulled down to try to keep that ball there. And then, you can imagine the sort of muscle spasming and the pain that's associated with that. And then think about doing, your routine activities every day. You're brushing your teeth. You're trying to back out of your driveway, have a phone conversation. So you get a sense of sort of how debilitating cervical dystonia can be for some.
Are these symptoms something that present like immediately, or does it take years or, some length of time to where, you wake up one day and all of a sudden you can't do what you were doing yesterday, or is this something that takes a long time to develop?
Yeah, that's a really good question. Everybody's a little different. For some, they wake up and they sense that they sort of slept wrong. Mm-hmm. And, we've all had that occasion where you sort of slept funny and you wake up and your neck hurts. And you're not able to, you don't have the movement in your neck that you might have. And then it does get worse. Mm-hmm. For others, it really can be where all of a sudden they're just not able to hold their head. For some, there's their head tremors as well. So sometimes that symptom may present after the neck pulling.
Now, you say that it presents from a muscular standpoint, even though it's a neurological disorder. In your experience, how often is dystonia misdiagnosed as the symptoms mimic something else?
Unfortunately, it's commonly misdiagnosed because not all healthcare professionals recognize it. It's not something that even general neurologists may commonly see. And again, patients may sort of dismiss some of the early symptoms early on. So, there's no biomarker, those kinds of things that typically physicians would look to utilize in making a diagnosis. So it's not uncommon for patients to go from doctor to doctor to get diagnosed. And in some cases, actually, we have situations where dentists are making the diagnosis because when a patient is in the chair, they just don't have the ability to move their head the way they need to when you get your teeth cleaned or if you're having a filling done. And dentists are actually recognizing it and encouraging people to seek out what we call movement disorder neurologists, which is a subspecialty of neurology, and people who are much more familiar with dystonias and how to both diagnose and treat it.
Now, the Dystonia Medical Research Foundation is involved with a company called Allergan Incorporated. You two collaborated to conduct a survey recently. Could you talk about this survey? What were the results, and what were you hoping to find in the first place?
Sure. So we've worked with Allergan for 20-plus years now. They were the first in the market to have botulinum toxin, or Botox, approved by the FDA for the treatment of both blepharospasm, which is dystonia in the eyelids, and cervical dystonia. And we've been fortunate to partner with Allergan in patient support and patient awareness kinds of activities. And with this particular survey, we were very interested in learning about the cervical dystonia journey from the patient perspective, and specifically what they knew about Botox and their awareness of it. So as we started talking this morning and realized that not many people are aware of what dystonia is. They've never heard the word before. It's not uncommon for people to be hearing the word dystonia when they're getting the diagnosis. Most people are then unaware of what the treatment options are and associate Botox with really, frankly, cosmetic use, not recognizing that, in fact, it was approved by the Food and Drug Administration first for therapeutic use in situations like with cervical dystonia. So we wanted to find out from patients, what did they know, what were their expectations of Botox treatment, where did they go for information, those kinds of things.
Where can folks go online to learn more about your organization and Allergan?
They can go online to learn more about cervical dystonia and the treatments like Botox that are manufactured by Allergan by going to our website at www.dystonia-foundation.org or contacting our office by phone. Some people actually do still use the phone, 1-800-377-DYST or 1-800-377-3978.
Now, in wrapping up, Janet, what was the one thing, I know there were many results and many findings, many of which were surprising, but what was the one thing that stuck out to you as being that significant, myth buster when it came to dystonia and Botox as a treatment?
Well, I think that people need to recognize that there are treatments available for this disorder, and that treatments that can provide really good benefit, really restore quality of life, and that it is a botulinum toxin, and that it's been used safely for 20-plus years. I think people just aren't aware of that. And once they are aware of it, it can make a significant difference in their lives.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Been talking with Janet Hieshetter, the Executive Director of the Dystonia Medical Research Foundation. It's been great having you here with us in studio today, Janet.
Thank you so much again for your attention on this important health issue.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.